Welcome, everybody, to today's FDN broadcast of Lab and Learn with Dr. Aaron Gonshore and myself, Reed Davis. I'm the founder of FDN and have been working it for 7 years now, trying to help people understand the underlying causes and conditions before disease takes place, or if it has taken place, what can we do to reverse that naturally, very much drug-free type solutions. So our basic understanding in FDN is that you've lived yourself into the problems you have. And if you understand what's really going on in the body, you have a better chance of living yourself back out of that. So with that, I'm going to introduce Dr. Aaron Gonshore. He is our scientific advisor at FDN, and he's basically our lab guy. So we have a very interesting case to go over today. Dr. Gonshore, I'm going to turn it over to you, sir.
Well, thank you very much, Reed. And this is the first of a whole new group of times we're going to be together. And I think it's a very important series of Lab and Learn, dealing with the fundamental aspect of what we like to think of as being important in any way of assessing someone's situation. And that is the proper use of laboratory information. And so we're going to go over, as you said, every time we get together, we're going to focus in on another part of many of the labs that are being done. And so I think what I'm going to do, without further ado, is to actually show what we're going to be looking at.
And while you're doing that, I'll just let the folks know that FDN is a way of thinking and it's a methodology. So it's a method of investigating underlying causes, conditions. It's a way of thinking about it that we're always looking at removing the causal factors rather than trying to treat the disease. This works for everybody, and we get every kind of complaint you can imagine. Everything walks through our door just like it walks through your door, or whatever type of practice you have. And you want to help those people. So we obviously are going to take their history and do lots of things, but generally they've already been to 2 or 3 or 4 or 10 other practitioners and haven't gotten the results that they've been looking for. So this is for those kind of people. Dr. Gonshore, who are we looking at today?
Well, we have, this is the FDN case study. We're going to each time look at a case study. It's just a way of focusing in on why we're using a particular type of test profile, etc. And who do we have today? Well, we're going to be looking at a 57-year-old female who is a night shift worker, and her main complaints are joint and hand pain, knee pain. So you're looking here at pain in various joints, headaches, a history of autoimmunity, and with Barrett's esophagus, we're going to go over as to what that is, osteoarthritis, trouble losing weight. This person is extremely emotional, gets depressed very, very easily. The diet has not been great, basically a typical standard American diet, which we'll go over as well if we have to discuss why that is an issue. She says the work is extremely stressful for her, not only because of being night shift, which is, as you know, extremely stressful in and of itself, but because she says she does not feel she's being appreciated. So for whatever that's worth, we'll be going over that. And I'm going to be telling you that what we're going to discuss in the next few minutes is a particular part of the various tests that we do. The one that we're going to be looking at is the mucosal barrier assessment. That's going to be the focus of today's session. And we're going to be looking at what that actually gives us. Looks at permeability. It looks at various inflammatory issues, acute inflammation, how that is resolved normally. And we'll make mention of dysbiosis, the permeability issue, and chronic inflammation. That's what we're going to be doing today. In future times, we're actually going to be looking at some other things. Just to let you know, over the next couple of sessions, we're going to be also looking at a salivary assessment of stress and hormone profile, which will also be important in this case. But we're not going to be looking at that in detail today, nor are we going to be looking in detail at the metabolic wellness profile, which is another issue. So what I'm going to be spending a few minutes on, and it's going to be sort of a look from 30,000 feet up. It is just a quick review of a mucosal barrier assessment. Now, what does that mean? Well, in order to understand what that is, you need to remember what is the pathogenesis of inflammatory and autoimmune disease. Well, one of the things that you always need to look at is what is the genetic disposition of that individual? And that's true of anything. That's always there in the background and sometimes in the foreground, but definitely in the background. The second thing you look at are various environmental triggers. And I'm just giving an example here of dietary proteins, peptides, of course, infections, the 60-odd thousand chemicals, many of which are toxic to our body, etc. The third thing is the microbiome, that 150 trillion bacteria sitting in our gut. And I'm not discussing the other trillions that sit on our skin, etc. But the gut microbiome and what happens when it becomes dysbiotic. Dysbiotic meaning that you lose that balance which those 150 trillion bacteria have created. What happens when it goes out of balance? Some pretty bad things happen. So dysbiosis is an extremely important issue. And both the environmental triggers and the microbiome and its dysbiotic issue can create localized, meaning intestinal inflammation and an immune response to that. That in turn will cause, in many cases, more generalized inflammation and even autoimmune disease. And the environmental triggers and all of that inflammation in the intestine will lead to an increased intestinal permeability in almost all cases. Well, if that happens, that increased intestinal permeability now will create even more inflammatory issues in the body. And now you're into a vicious cycle. And the two of them are playing against each other in a constant way. So I've created this to give you an idea that this doesn't happen just out of the blue, but there are a series of things that have to happen in order for this to occur. So what is the role of biomarkers? Because we're going to be discussing over the next number of sessions various biomarkers. And what do we look at? Well, the one we're going to be looking at in detail today, one of the two, is zonulin, which is able to modulate or even reverse some of that permeability issue. Extremely important. The second thing we're going to look at today is histamine and its enzymatic breakdown product, which is diamine oxidase. We're going to call it DAO. So we're going to be looking at histamine and DAO. And what we're going to make mention of, because it's going to be added to this particular profile, which we're going to be talking about, is the jewel in the crown, which is LPS, lipopolysaccharide, which we're going to be coming out with in a few weeks. And I'm just letting you know, look at all these arrows. LPS has an effect on the microbiome. It has an effect on inflammatory disease, both local and chronic, generalized in the body. And it is a potent effector of intestinal permeability. So we're going to be going over that in detail at some other time. So increased intestinal permeability and zonulin. And FP is the family of peptides which together are known as zonulin. And we can discuss that in a few minutes. So we're going to call it zonulin. What is zonulin? Well, first of all, what is intestinal absorption? let's just get an understanding of what we need to know in order to see where zonulin comes in the picture. The intestinal mucosa has a very paradoxical role. On the one hand, it allows us to absorb nutrients from the gut into the body, but at the same time, that intestinal mucosa needs to both exclude toxins, macromolecules, stuff that it doesn't want to get into the body, at the same time that it is bringing stuff into the body, right? That's the way we get food and everything else into our body. So if you get a breach, if there is a break in that mucosal barrier, that can lead to a whole number of things. One of them is malabsorption. You're just not going to absorb food properly. And we're not going to discuss that in detail today, but that's one of the issues. And secondly, an increased exposure to various toxins, to antigens, which are coming in through the gut. And so one of the things that we do is that we have a lymphoid tissue system. There are all kinds of containment systems right up in the gut itself that keep whatever is bad from getting into the rest of the body. So right on the other side of this one cell mucosal barrier, which is the gut barrier, lies a lamina propria with all kinds of immune cells. And together with the bacteria, specifically commensal bacteria, those are the good bacterial colonies that are in the gut lumen, inside the gut itself, they will prevent potentially harmful stuff coming from the intestine from reaching into the systemic circulation. You want to avoid that at all costs. So you are able to induce a very high systemic tolerance against antigens in the gut lumen. So while the food and other stuff is sitting in the gut lumen, we have a system in place that the body has created to keep stuff from even getting out of the gut. Get that bad stuff from never getting out of the gut. How do we do that? We do it with something called secretory IgA. We'll discuss that at another session. Various types of regulatory immune cells, and all of that tries to keep whatever was in Vegas only in Vegas and not let it get out. So what is intestinal permeability? Well, it's really a movement across the gut wall. And there are two ways that that happens. One is between cells, para or intercellular diffusion. Stuff gets into the body from between those barrier cells, or it actually goes right through the cell. The cell itself pulls certain things in through the cell. And so zonulin, what is zonulin? Well, I'm going to say to you, it is the first objective biomarker that was discovered going back about 15 years ago that controls the opening of that paracellular pathway, that's pathway between the cells, because that pathway is not just open, it's got closures, it's got junctions that keep it closed or open, depending on what the body wants to do. And zonulin is key in opening up those sluice gates, opening up those gates, open and close. It's a defensive mechanism. And I should make, as an aside, the way zonulin was discovered is that a group that was headed by Alessio Fasano in Massachusetts, what were they looking for? They were studying a particular bacterium called Vibrio cholerae. Vibrio cholerae is the bacteria that causes cholera. Cholera is a devastating disease, and the disease basically is that the person loses fluid from the body. It just continues out of the body through the gut and through diarrhea, etc. They basically die of fluid loss. And it's caused by this particular bacterium, Vibrio cholerae. Well, it turns out that this cholera bacterium creates something called zonulin occludens toxin, ZOT. And that's what really ends up causing the body to really fall apart. And so that first term, zonulin, is what was taken as the word that would be utilized for the discovery of what this bacterium does. It really creates this toxin that attacks these tight junctions that are keeping the closure between cells. It opens it up wide and just lets fluid to flow out of the body. That's the way we discovered it. Most of the time now, we're not discussing fluid going out of the body. We're talking about what's coming into the body. But it's the same thing. It allows stuff to get in and allows stuff to get out. So those tight junctions need to be controlled by something, and zonulin is what controls it. It controls it rapidly, it controls it reversibly, and reproducibility at the same time. So just to let you know that zonulin right now is one of the only physiological modulators of intercellular tight junction control. It helps control macromolecule movement. In other words, food or anything else to get in. And in that way, it modulates the tolerance and immune response of the body. In other words, it allows the body to control stuff coming in from the gut before it ever gets into the rest of the body. That's critical, because when stuff gets into the rest of the body, you've now got a major problem, because the body sends out the big troops. It sends out the nuclear bombs, the big immune response. And that's not what you want. You want that immune response to almost never have to be utilized, because it ain't good. If that immune response gets used, then that tremendous amount of immune cells that start firing off and doing their work will cause, in many cases, severe disease and even death. You don't die from the toxin, you die from the overreaction of the body to that toxin. And just to let you know, the causes we know of increased zonulin and the development of increased permeability, there are two classic ones. There are this 1 or 2% of the population which has celiac disease, which is a very strong reaction to gliadin in the diet. We're not going to go into that today. We could at some other time. And dysbiosis. Remember, I mentioned dysbiosis is an imbalance with all the bacteria, especially overgrowth of the negative bacteria. It can be the harmful forms, normally gram-negative bacteria. It can be fungi like Candida, various types of yeasts, parasitic infections, etc. You name it. So that was just very quickly, just to mention zonulin. We'll discuss it again in a few minutes. The second thing to remember is one of the other things we test for is histamine and diamine oxidase. And that is looking at intestinal inflammation. What's histamine? Well, histamine is a biogenic amine. There are various kinds of histamines. There are also many different receptors for histamine. There are 4 major groups of receptors, H1 to H4. So depending on where in the body histamine is acting, it's actually acting on very specific receptors. So the receptors in the upper respiratory tract and the lung are mostly H1 receptors. The ones in the gut are H2 receptors, etc. And all of those are being affected by histamine. We're going to focus in on the gut receptors for histamine. And where does histamine sit? In the case of the gut, it actually sits within the mast cells. And the mast cells are a part of the immune system that literally sit right up against that one cell mucosal wall of the gut. They're sitting and sort of waiting for stuff to happen. As soon as something gets through the tight junctions, gets into that area where the mast cells are, then the innate immune system, which we all were born with, just shoots off and says, uh-oh, we better bring in some of the smaller troops to begin. Let's see if we can stop this very quickly. And the mast cells begin to disgorge various types of proteins. And one of them is histamine. There's also TNF alpha and others. And what do? They are there to begin the process of healing the body, because inflammation is the first step in healing. And histamine is known as a pro-inflammatory cytokine. What does that mean? It causes inflammation. And cytokine is a messaging molecule. So histamine acts as a messaging molecule which creates inflammation, which isn't a bad word. It is the way the body will begin to heal. And just to let you know that histamine, when it's out there, the body says, listen, do your stuff very quickly, histamine. Create an acute inflammatory response. In other words, very quickly get rid of what needs to be there. But then we want you out of there. We want you to leave. Well, how do you leave? Well, we've got a molecule for that. And we've created diamine oxidase in the gut that is going to neutralize histamine. It's an enzymatic process. Histamine gets into the gut, starts to do what it's doing, and very quickly, the body is supposed to take DAO, diamine oxidase, and neutralize histamine, get rid of it after it's done its job. Thank you very much. All taken care of. Well, that's fine until it doesn't work as well as you'd like, until it's unbalanced. Just remember one thing about DAO, one other thing. First of all, it neutralizes histamine, but it has another function in effect. It also is able to indicate if there is intestinal damage to that mucosa, that barrier. And so it becomes another biomarker of intestinal permeability, and we can discuss that. And just to let you know, histamine normally in the blood is at very low levels. And if it gets to higher levels, just to give you an idea, anything over 1 nanogram per mil, which is not a lot, will increase gastric acid secretion. It begins to increase the heart rate. And if you go any further than that, any higher amounts, you start getting tachycardia, headaches, urticaria, then decreases in arterial pressure. You go into bronchospasm if there's too much histamine, and eventually can cause cardiac arrest. So let's be clear. Any of these cytokines, if they get out of control, can be extremely dangerous. And I think that's all I'm going to say on these two, because what we're now going to do is to start a little bit of a discussion of some of these issues.
Well, this is our favorite part coming up. I was looking forward to seeing those lab reports because,
Well, we'll show it to you.
well, you know, in FDN, we run a lot of labs, and I love this mucosal barrier assessment, along with the other two labs that Dr. Gonshore mentioned, the stress and hormone panel and the metabolic wellness panel. These are things that are easily done at home for not very much money relative, and puts the person in the driver's seat. So we need this data to figure out what's really wrong. You could look at the symptoms and treat those. There's lots of anti-inflammatory agents. There's other ways to have a person temporarily feel better, but that's not the mission of what we do. We really want to find the underlying cause, conditions, and reverse them. remove whatever is stimulating them and all these kind of things. So it's very sort of lifestyle medicine type of an activity, FDN is. And we depend on the data. And this is a person's data. This doesn't belong to the doctor. It's not some secret thing it's look, here's what's going on. And then it correlates very highly. You can actually explain why people are so frustrated. When you show someone test results and explain, well, this is why you feel so lousy when maybe no one else has figured it out yet, it's very uplifting and emancipating for that client. It's why we do it. And it's why they hire us and pay us to do this kind of work. And so here we have this poor woman who's been suffering for a long time. I said she'd been to 3 or 4 or 5 practitioners, and they all want to treat the symptoms. But again, we're going to sort of put an end to that cycle of trial and error by looking at those test results. So, I'd like you to feel free to go to the test results, except
Okay.
I mentioned the 3 labs. It's very important to get all 3 because these markers aren't in silos. They're the activity that we're looking at, the measurements we're taking need to be looked at relative to the other things going on in the body. The dysbiosis that Dr. Gonshore mentioned, and there could be food sensitivities. There could be bigger, badder bugs. I think that's the medical term for bacteria and overgrowth and biofilms and lots of things going on. So we don't just look at one test and treat the paper. That's just too allopathic. We want to look at it relative to these other markers. So the way that we identify it is we're identifying multiple healing opportunities and then capitalizing on those observations by working on them all simultaneously. As long as the downward spiral isn't like the histamine is so high that they're going into shock. That's not what we're talking about. Just these long-term chronic stress-related disorders that you have to have this data so you can start backing away from so the damage doesn't get that bad. I also really appreciate that Zonulin is a two-way street. Initially, it's a good thing because you have the zonulin will open up the tight junctures so that from within the lamina propria you can excrete some of the extra histamine or whatever's going on there, all kinds of nasty toxins and what have you. So it's a good thing. Zonulin is your friend until it's not. And that's when the chronicity kicks in. So the fact that it's a two-way street, it's a subtle consideration, but it's a very important one. And then when you mention the celiac, there's also non-celiac uh, uh, gluten or gliadin sensitivities, which are a constant barrage of assault and offense to these tight junctures. And again, so zonulin just starts getting, I think, overproduced. So you can take it from there, Dr. Goncher. I just want to give some, just a bit of a reality check.
Thank you.
FDN practitioners are well studied in the anatomy and physiology and biochemistry, but the other point is to make it make sense to the person. So we finally just explained to Mrs. Jones there why she feels so lousy when everyone else just said, here, take this pill. Hope it helps.
Well, let's see if we can figure some of that out. And by the way, one test in and of itself will not be the only way that you're going to do this. That's one of the reasons why you need to have, as Reed said, a number of other tests. And that's the way life is. You work it that way. Well, let's just take a look at a typical report. So this is a report for the mucosal barrier assessment. In our lab, we call it the intestinal IQ, report. And this is what you would normally see. I'm not showing you the area above, which would be the name of the person, etc. But this would be the important part of the report. And it's just to remind you that when we're looking at some of this, we use what's called quintiles. And quintiles are fifths, 20% of a population. And so the reference range that you look at represents a quintile distribution, each quintile being 20%, 20, 20, 20, etc. And when you do that, you can reproduce quite accurately where that individual is within the scheme of things, right? Within large population groups. And so what you see is the quintiles. We even give you nice little colors. So in the case of zonulin, you see green. I'm going to discuss a tiny little bit of red on the extreme left. So this is when it's low, and then it starts getting higher. So it goes to the second quintile. Then you get to the third one, which is sort of the mid-level, where the yellow is slowly beginning to turn into red. Red, of course, is what you would rather not have because that's an elevated level and it can go to even higher levels. The diamond, which you see here, is where this individual's actual number is. So the lab was able to determine that for this individual on this test on that day, this is where they were. And we actually have a number for it because we're actually able to get analytic results which tell us a specific number. So in this case, for example, the zonulin is sitting in the elevated level and it's at 14 nanograms per mil, as you can see. So 14 nanograms per mil in the elevated area where you do not want to be. You don't want to see that individual get up to that area. I mean, clearly what you would like, all things being equal, you would like to have someone sitting in the lowest or within the first two quintiles, because that is a lower level of zonulin. And the same with all the rest of them. So the test result is in a little box that you see above the horizontal line with the quintile. So you actually have the number, and that number is related to the diamond. So it's just to let you see exactly what is going on here. So let's just very quickly describe what you would normally be looking at. Well, if you're interpreting it, if you're sitting anywhere from around 1 to 7.5 nanograms per mil of zonulin, what it's saying is, oh, you're in that first quintile. There are some inflammatory problems. All of us do. We're constantly in having a certain amount of inflammation. That's normal, and it's good because it keeps everything primed. What may be the problem when you're down here is not so much inflammation, but it is intestinal drying, that the area of the gut right up against the cells doesn't have a proper mucus level. And to know that, we're bringing in a lot of stuff here. In the gut, it's not just an open, dry hole, but the cells on their gut side have an area of mucus that is sitting right up against those cells. And that mucus layer is an important layer because in that layer lie various immune cells of the body, like SIG-A and various others, which I'm not going to discuss right now, and various bacteria, which are the commensal bacteria. Commensal meaning the good bacteria. And they are there as a bulwark to make sure that the bad stuff doesn't come up against the cells, because those cells say we do not want anything that is negative to come near us. And just to remind you, the cell has coming out of it a series of villi. These are like little mountains coming out of the cell. And in there, in that whole series of thousands of little cells sitting in the, it's sort of like the pyramids or the Himalayas, with all of those cells sitting out there, they need to be covered by something. And that cover is the mucus. So you can have mucus drying. And that is one of the initial signs that you are beginning to have gastrointestinal issues. I want you to keep that in mind.
I want to point something out here too, Dr. Gonshore, that these are moving targets. And one of the most important questions you could ask is, whose test results are these? Because we're not going to treat the paper. If you have that mindset, you might look at this and go, oh, you're fine. It's in the good range, but it's relative to a person. So again, back to, does this explain how the patient is? Well, you would look at other markers. First of all, do the clinical correlation, and the person feels lousy. Does this help explain it? Well, in terms of the dry gut, absolutely. So we clinically correlate and then look at the other markers that are very relative to it. I often say, and then back to you, Aaron, that there's a whole constellation of markers or healing opportunities. And that's why we're so considered so holistic.
By the way, you're absolutely right. And that's the reason why doing a single marker is normally almost a fool's game, because you're not going to get the type of overall picture, the profile, a very focused profile of what's really going on. Very important, Reed. Now, just very quickly, of course, things can get worse. You then go into those next two quintiles, which we're calling the borderline area. Gut inflammation, now often due to dysbiosis, various enzyme imbalances, which are not permitting the area to stay cool, to stay neutral. It now begins to affect permeability in a very specific way. But that's not the worst of it, because then you continue on. You go into an elevated area. Now you're beginning to get the signs and the symptoms of tight junction permeability. They're beginning to open too much, too often, and too long. Why? Mostly due to dysbiosis, but not only dysbiosis, also because of enzymatic issues, imbalances, hormonal problems, especially stress, because cortisol will affect zonulin. And I'm saying that now for the first time. Cortisol has a dramatic effect on zonulin, as well as some of these other cytokines in the area of the Peyer's patches or the lamina propria, that area where I told you before the immune system cells actually sit. So keep it in mind. Someone who is under stress is affecting the gut through the effect of cortisol. Just to let you know, there are a very, very small group of people who don't actually produce classic zonulin. They produce other peptides which are within the family, but they don't produce zonulin. So those people are going to show way down at the end on the left side, almost close to zero or zero, non-detectable. When that happens, someone doesn't come in and say, oh my God, what's happening to me? I don't have any zonulin. Well, you have something else that is taking over, but we're testing for zonulin. And so you may not see it. Very, very few. It's quite rare, but can occur. And then there are those people who are really in a very difficult situation. And when you see certain people, you will find them for the first time already in the fifth quintile. And not only in the fifth quintile, but they're already moving upwards. Remember, the fifth quintile starts at 13. You will see people like we see here at 24. These people are in highly inflammatory states. Some of them have autoimmune disease. If they're in an inflammatory state, quite often it's because of chronic inflammatory bowel diseases. And you need to know that. You need to be aware that these people are really in trouble because their ability to keep those tight junctions closed has almost evaporated. And just to let you know very quickly, histamine, When it's very low, when it's in that sort of an optimal level, the inflammatory problems that it's creating because it's a pro-inflammatory cytokine are insufficient to really affect intestinal permeability, although inflammation is beginning, but it's not sufficient to affect the rest of the body, because remember, it's the tight junction opening and having those toxins and everything else get in that begins to affect the rest of the body. But, and I'm just jumping to the other side, if you have higher levels of histamine, remember, stuff begins to happen. Gastric acid secretion, increases in permeability. It'll happen quite often because of ingested food that is very rich in histamine and histidine. Histidine is the precursor of histamine. It's what creates histamine. And many foods and bacteria take histidine and turn it into histamine. Oh, wait a minute, Dr. Gonshore, you didn't mention that. You mean there are bacteria that cause histamine? Yep. There are foods that cause histamine? Yep. So wait a minute, now we have a whole bunch of ways in which histamine is being created. I wanted to throw that in. So it's not just a histamine coming from the lamina propria, from the mast cells. It's coming from someone who's eating food that is filled with histaminic substances and precursors to histamine. And the bacteria are having a field day creating histamine. And they are also deficient in DAO. So why do you get high levels of histamine? Because they don't have enough DAO to break it down, etc. And of course, DAO itself, which you need to remember, needs to be looked at together with histamine. And why? Why do we need to look at that? Because if you are looking at histamine and DAO, you need to remember that even normal levels of histamine, which are, let's say, down here in the green area, if there's not enough DAO to break it down, DAO is not being produced for whatever reason, then even what you would consider as normal levels of histamine can now be very detrimental to the body because it's not being broken down and they're sitting around. So remember, it's not just what is the absolute number of histamine, but is it being broken down by an amount of DAO which is needed to neutralize it?
I love this marker because the ratio of DAO to histamine can almost help, it can help you visualize what's going on with the villi inside where all the inflammation is, where there's this
Exactly.
weakened mucosal barrier. Most of the DAO comes from the crypts that's produced in the cells in between, in the little deep crypts between the villi. And so if it's really chronically low, you can pretty much vision that those crypts, there's what they call crypt hyperplasia. Everything's flattened out. The villi have been beat down. And again, when you go back to the person, this 57-year-old woman with all of these complaints, it, along with the other markers that we might look at, uh, presents a very accurate picture and shows you what you need to do to return health to this person. Of course, there's nothing wrong with relief care because you want to help people feel better. And there's lots of ways to do that. You can intercede, but the real job for us is to heal, heal, heal. And it can take some time. But when you have the data, you can go by her symptoms. Of course, she should start to feel better and digest her food better and evacuate more regularly, and all kinds of things start to improve for this person when you're working on the right functions. And so I think that's an excellent summary there, Dr. Gonshore. And we'd love to do long form of this same kind of a show, but we're trying to get it done so that people can come, learn something, come back later for some more, and let you finish
Well,
it off.
I'd like to just mention, this is her result. This is the actual report for this individual. Remember, 57-year-old female,
Mhm.
joint, knee pain, hand pain. Remember what I mentioned about pain when you have high levels of histamine or there is an imbalance, headaches, etc., right? Extremely emotional, stressed, whatever that happens to be. So let's take a look at this. And here is exactly what we were mentioning earlier. You look at Zonulin, you say, oh, the Zonulin's low. Okay, she's fine. No, she's not fine. She's not fine. Look down. Her histamine, she's going off to the right side. And remember, it's low on the left and it's high as you go right. She's not only quite high, but let's look down at the DAO and just watch out. It's low here on the right and high on the left. There's a reason for doing that. And it has to do with the fact that DAO breaks down histamine. So wait a second, very high histamine, which doesn't have enough DAO to break it down. So this person is now feeling the effects of very high histamine. Look at the ratio. She's got a very red ratio. Too much histamine, much too much, which tells you just from this test alone why she's having joint, hand, and knee pain. She's got headaches. Remember, people talk about, I got a histamine headache. Well, it's true. It's true. And the effects of, she has a history of autoimmunity. I don't know how strong it is, but definitely whether it's autoimmunity or she's got a chronic inflammatory problem due to the histamine and maybe other cytokines is quite clear. And she's also clearly stressed. And so that is what's causing a lot of this particular problem. So remember, these tests are analytical tests, and we're not diagnosing anything here. We're not diagnosing what she's got. We're just saying that she has, from this test alone, it's giving us a very clear window into what may be going on. And one of the things that I would mention is when you're looking at this, and I get this question asked of me quite often, what do I do, doc? So I say, well, I'm not supposed to be answering, what do you do? That is something that you have to deal with. I have the easy job, which is to do the labs. But one of the things you look at here, you say, well, DAO. Okay. One of the things to do is increase DAO. And the other thing that you want to do is decrease histamine. Well, if you're going to decrease histamine, the first thing you need to do, and Rita goes to exactly what you said, what started all of this? Is it her diet? Is it various other things? What is it, a dysbiotic problem that she has? Something is creating this histamine, folks. You need to
Something.
know that.
And the point being that you can't empty a bathtub when the water's still running. So just doing antihistamines is not going to help.
No,
Again, temporary relief, sure, nothing wrong with that. But to get to the bottom of it is probably going to take a little more investigation. Now we have here a clearly identified a healing opportunity, the thinned mucosal layer and so on, the crypt hyperplasia, the blunted villi, that could take some time. But if we can do the rest of the investigation, we'll be able to put Mrs. Smith on a very clear path of self-healing and teach her what she needs to know. The data always belongs to the patient or client, not to us. We're just there to run the labs and explain it to them so that they can, again, if you want to capitalize on these observations, you work with that person. And that's what FDN is all about. So, Dr. Gonshar, I don't feel like I'm cutting you off in a way, but I think if we keep these down to about an hour, we'll get more views. We're going to be doing the next one in 2 weeks. So we hope you'll come back to our channel and click like and subscribe and all that stuff. Make comments if you wish. Tell us what you're looking for, what you'd like us to talk about next. We've got some plans, but we're always open to your suggestions. So thanks for being a good audience. And thank you, Brenda, for helping out in the back room there. And Dr.
Thanks,
Gonchar, it's
Brenda.
always a great pleasure.